Hello, everybody, and a really big welcome to all of you. My name is Dr. Anthony Smith. I'm president of the Southern African Sexual Health Association, and it's a great pleasure to welcome you all to this SASHA webinar series hosted in association with WAS and paving the way to the 25th Congress of WAS, that's the World Association of Sexology, in September of this year. We welcome those who accompanied us through our SASHA Webinar 2020 series and those who attended the WAS 2020 monthly series of conversations, webinars, and those who joined us for the first time today. From Southern Africa and from all around the world, we say hello to you, and please introduce yourselves on the chat. We want to know who you are. We want you to participate and to add to the conversation. We start off 2021 hopeful for new beginnings. Hopefully the waning of the virus and the promise of vaccines, contrasting with the weariness of the long haul since this pandemic started and the sacrifices that we have made. The Southern African Sexual Health Association has much to look forward to in the year ahead, but we would be remiss not to look back and to acknowledge what we have lost. And in particular, tonight, we would like to remember the healthcare workers in South Africa and around the world who have, in the course of their duties, become infected and succumbed to the COVID-19 virus. So before we start our proceedings, and in this spirit, I would ask if we could all observe a 1-minute silence. Thank you. Thank you to all of you. A very short introduction. I think many of you know already that you know about SASHA and you're familiar with the Southern African Sexual Health Association and our commitment to educating, connecting, and upskilling healthcare providers in the area of sexual health throughout Southern Africa. We really want you this year to join our family. We want you to contribute and strengthen our cause, and we want you to become members of SASHA so that you can join us and make a real difference in the year ahead. This year is a particularly special year, and we are very excited to welcome and introduce the World Association for Sexual Health. Together, we have designed a compelling range of webinars, which are destined to examine and interrogate the most salient contemporary issues in sexual health, and we invite you to join us over the next several months, culminating in the 25th Congress of WAS. It's therefore gives me great pleasure to introduce Professor Pedro Nobre, the president of the World Association of Sexual Health, a great supporter of bringing WAS to Africa, and prior to the realities of the pandemic, a champion of Cape Town as the next destination for the 25th WAS Congress. Pedro Nobre is a full professor of psychology at the Porto University. He's also director of the doctoral program in human sexuality in the Laboratory of Research in Human Sexuality, also known as the Sex Lab, at Porto University, as well as chair of the Research Center for Psychology at the University of Porto. He's widely published over 100 scientific papers, including topics such as the psychological factors contributing to sexual dysfunctions, psychological treatments for sexual problems, psychosocial predictors of sexual health and well-being, psychological models of sexual function and dysfunction, and neuropsychophysiological correlates of sexual health. My word. Okay, so it gives me a really great pleasure to hand over to Professor Nobre.
Thank you very much, Anthony, for your very kind words. Welcome, everyone. Thank you for joining this SASHA partnership with WAS series of seminars, webinars. I have just a couple slides to share with you, but before going into slides, I just want to say actually a couple of introducing words. First, it is, as Anthony said, it is a great pleasure for me as president of the World Association for Sexual Health to be president when the first World Congress will be held in Africa ever. Unfortunately, as you know, it will not be possible to hold the Congress in Cape Town as we wished, but we will have a great virtual Congress online, and with I'm very sure a lot of African flavor and South African flavor. So thank you, Anthony, and thank you, Elna, as Congress President, for that opportunity and for working together. Let me also, I will briefly introduce you also to the World Association for Sexual Health. Let me just briefly say that WAS, for the ones who are not aware, is a World Association for Sexual Health, and it's one of the oldest, if not the oldest, World Association in the field. We were founded in 1978, so we will be 43 years soon. It's probably the world's largest international association, and we represent over 100 organizations and thousands of professionals from around the world in a variety of different disciplines and backgrounds. And WAS mission is actually a very broad mission, but mostly WAS promotes sexual health and sexual rights throughout human lifespans all over the world by developing, promoting, and supporting sexual health and sexual rights for all. So as you can see, this is a very ambitious mission and goal, but our aim is actually to promote sexual health and rights all over the world. And for this to happen, of course, we need to work in partnership with global organizations and with national societies, associations, institutions from all over the world. And so we actually have a number of partnerships with global organizations that help us achieve our mission and goals. WHO, UNFPA, UNESCO, UNAIDS, the Pan American Health Organization, IPPF, just to name a few of them. We also have an important declaration of sexual rights, which was for the first time in 1999, and we have a second version of that sexual rights declaration. And this is a very important part of what we do, because we promote rights and we define a number of rights that are actually belong to the sphere of human rights. Sexual rights are human rights. And this has to do with what is the topic of our seminar today. We also have more recently a WAS Sexual Pleasure Declaration, where we emphasize the importance of sexual pleasure for sexual health and for sexual rights. We also celebrate every 4th of September every year the World Sexual Health Day. And this last time was actually devoted to sexual pleasure in times of COVID pandemic, COVID-19. So every 4th of September, we welcome everyone to join us in celebrating the promotion of sexual health and sexual rights for all over the world. We also release important statements on sexual health and rights issues globally. These are some examples that you can see here. Was statement on LGBTQI plus rights, message of solidarity for calling the end of systemic racism, or one statement about the context of sexual rights in the context of COVID-19 crisis. One important mission is also research. We are partners with WHO on a global survey on sexual health. So it is important that all that we do is based on evidence, scientific evidence. And so we also give a lot of focus and importance to evidence, scientific evidence, and research related to sexual health and rights. And so I will be very pleased to welcome everyone to join us as WAS members. We have actually individual membership as well as organizational membership and student membership. So there's a lot of opportunities if you work in the field as an individual or as involved in an organization in different perspectives on sexual rights or sexual health, please join us. We are a group of, let's say, 20 people that represent WAS as advisory committee, and we will be very happy to welcome you all. One last slide just to to say. Elna, of course, will talk about this, but the topic for the team for the next Congress actually is Leave No One Behind, and it's a great team. And again, thank you, Anthony, and especially thanks to Elna Rudolph, who's a great woman and a great WASwoman and a great South African woman, who will be the next Congress president. Thank you very much.
Pedro, thank you so very much. I want to take this opportunity to introduce Dr. Elna Rudolph, who's going to be co-moderating this evening with Professor Nobre. And Elna, whose really unique vision and drive cannot be understated in cultivating and professionalizing sexual health in South Africa. So it's a particular pleasure to introduce her. Well known to many of you as a medical doctor and sexologist from South Africa, who represents tonight both organizations here, being President-elect of SASHA, as well as the Regional Secretary for Africa on the advisory board of WAS. She's the president of the 25th Congress of the World Association for Sexual Health, and we'll be telling you more about it shortly. Elna, I'm going to hand over to you.
Thank you very much, Anthony. It is such a privilege to be here today. It makes me so happy to see how this plan is coming together. So my journey with WAS started in 2011. I did my practical with Professor Kevin Wiley, and he was the president of the WAS conference in Ireland at the time. And I was flabbergasted, blown away by what I saw at that conference. It really convinced me that I wanted to become a sexologist. And at that conference, Marlene was actually there, and she was bidding for the conference to come to South Africa. But unfortunately, SASHA didn't have the legs that it has today at that time. And the bid was given to Brazil, if I'm not mistaken. But there was a flame ignited in me at that conference, and I really wanted to become involved in this organization on a serious level. And well, I don't know, sometimes I maybe regretted due to the time that we spent on organizing everything. But in 2015, when we went to Singapore, Wutke Anotten looked at me and he said, Elna, you have to bid for the conference to come to South Africa in 2021, so 10 years later. And look, I kind of just did what I was told. So when my daughter was 8 weeks old, my husband and I took her on a plane and we went to Prague, where the conference was at that time. I didn't miss a single conference until then. And with Delene van Dijk from South Africa, we did a bid and we won the bid. And then we knew that the conference was coming to South Africa. For the first time ever, the WAS conference was coming to Africa. And I was so excited about the idea of bringing the conference to Africa. And my plan was to bring 2,000 people together. And I was really looking forward to showing off my very esteemed and a little weird international sexual health friends to the South Africans, and for them to get to know all of us in South Africa. And then COVID hit, and I've cried about this many times, and we were forced to now have the conference as a fully online conference. And the irony is that we decided that the slogan for the conference is Leave No One Behind. And thanks to COVID, that is exactly what will happen now. You do not have to pay all of the money to get to South Africa, or even as South Africans to get to Cape Town. You can, in South Africa, under 1,000 Rand, and for international people, there are obviously different price ranges, but about $100, you will get 2 days of live sessions, 2 days of workshops, and a free youth pre-conference actually, and then 100 lectures online. Those are our plans for the conference coming up from 9 to 12 September. Please put it in your diaries and do not miss it. Believe me, a WAS conference changes your life. If you've done them in the past, I know you won't miss them, but if you've never done it, please don't miss this conference. It is really worth attending. I want to tell you about our team that's been organizing this conference. So first up, I want to tell you about Uwemedimu Uko Esiet. Michelle, can you please put him on the screen? You know, Uwem is a giant in sexual health in Africa. And Uwem, I met him in Sandton when he was doing the African Sexual Health and Rights Conference. And it was such a privilege to meet him and to get to speak to somebody of that stature. And you know what he told me? Elna, WAS knows nothing about what's happening in Africa. They've got no clue. And he wasn't particularly excited about the conference coming because it was a reality. You know, we're an organization that has literally left Africa behind. But I hope that you will agree with me that during the past few years, we've really tried to take hands with people from Africa, and with you in particularly leading us to be able to bring you a conference that will have a distinctly African flavor, with the African topics being very prominent, but of course, giving you the highest standard of the international science and making it an absolutely global conference as well. So thank you for taking my hand during this process and for leading us. Is the honorary president of this conference, as is absolutely appropriate. And then Marlene, I think Marlene Wasserman, our dream came true together in this conference, basically. I know that you've been wanting to bring this conference to Africa for a long, long time. And it is such a privilege for me. When we started putting the committee together, it was just the most natural thing for me to ask you to please be the chair of the scientific committee, as such a scientific giant in our country and worldwide when it comes to sexual health. So thank you for being on board and for putting so much weight behind this. I appreciate it. And then the rest of the committee is Pedro Nobre, who's the president of WAS, of course. And then I thank you, Pedro, because I remember the day when I had to phone you and say, you know, I think I should be the president myself. And I know I'm young and it's not the most common in WAS. It's usually an elderly professor who's the president of the conference. But I thank you for backing me to do this. You know, it's my absolute passion. Since that day in 2015, when Wood said that we must bring the conference to Africa, there hasn't been one day that I didn't think about this conference. It's really my purpose and passion to make it a success. And then Anthony, thank you for backing me when I said that I'm going to ask Pedro if I can be the president of the conference, that you as SASHA. And firstly, I actually have to thank you that you became the president of SASHA. You are a super president. And if it wasn't for you, SASHA wouldn't have been able to offer this strong structure of support that is there to host the World Conference. So thank you very much for your backing there as well, Anthony. And then we don't have Esther Corona, who's the Vice President of WAS, on here today, or Louis Perelman, who's the Secretary General of WAS, or Eric Janssen, who's the Vice Chair of the Scientific Committee. They're not here, but I also want to thank them for their leadership and support in arranging this conference. And then I have to get to the Chair of our Scientific Committee for the conference, Professor Alain Giami. Alain and I share a birthday, and the first time I really got to know Alain was, I don't know if you remember when we were together in New York, Alain, and we had dinner together. We were there to work on the Sexual Rights Declaration. And since then, you've become a dear friend, and I really appreciate what you are doing and the leadership that you're taking on the World Scientific Committee, and then coming up with the concept of sexual justice. And as I introduce Alain, I would like to just run the first poll about the concept of sexual justice. If it is something, does the concept of sexual justice make any sense to you? Is it something that you understand? We've got Lebogang Ramafoko here tonight, who is she's been fighting for sexual justice her whole life. That is what they do. So for her, it would, of course, make sense. But for us, it is a concept that we want to develop at this conference. And thank you for taking the leadership there, Alain. So just in terms of a formal introduction for Alain, he is the currently emeritus research professor at INSERM, the National Institute of Health and Medical Research in Paris. He is chair of the scientific committee of WAS and associate editor of the Journal of Sexology, the European Journal of Sexology and Sexual Health. He's currently serving in a task force for the creation of an archival center in sexual sciences at the Center Maurice Chalomo. Sorry, I tried to get that right beforehand, but thanks, Alain. And he has published more than 200 peer-reviewed papers and several books in French, English, and Portuguese. I now hand over to Professor Alain Giami to introduce the concept of sexual justice to you. Thank you, Alain.
Thank you everybody for being here. Thank you everybody for introducing me with such a warm words. It's really a pleasure and an honor for me to be here, to be among everybody here. And excuse me, I have some difficulties. And especially in the process of building a conference between WAS and SASHA and developing new collaboration with WAS, and we have already some members of South Africa from WAS, but especially to bring WAS in Africa, and I would say not only in South Africa, but also in other parts of Africa, since I have to say that I was born and raised part of my life in Tunisia, and I am very sensitive to bring people from West Africa, North Africa, Center Africa, all the French speaking, and also the Portuguese speaking countries to make this WAS Congress a real African experience and contribution, and to give visibilities to people from all these countries who have important needs in sexual health, sexual rights, and sexual justice. So I will give a short introduction of the idea of sexual justice and in the context of where it appeared. So I will give a first, the argument will be to develop a short historical perspective in the roots of European sexology, the turn of sexual revolution, the development of sexual rights and social justice, and then develop some aspects of sexual justice. But my presentation is more presenting a framework, a working proposal to be developed in the process of the next WAS Congress in Cape Town, even if it will be virtual, but it will be in Cape Town in next September. So at the beginning, we had, and backing to using and developing sexual justice is a kind of return to the roots of European sexology at the beginning of the 20th century, with great people like Magnus Hirschfeld, Havelock Ellis, Sigmund Freud, the first part of his work, who developed the idea both of the importance of sexual satisfaction and pleasure, besides the reproductive function of sexual activity, but also in the context of the World League for Sexual Reform, which can be considered as an ancestor of WAS, the idea of bringing together scientific knowledge, enlightenment, and social emancipation. So the DNA of sexual science is related to the fight for justice. And as one of our ex-keynote speaker in Prague said, Professor Jeffrey Weeks from London, it's through science to justice, which is the very idea. Another aspect of this sexual justice project takes its roots in the sexual revolution of the 60s, which is currently quite criticized, for what happened after. But we have some important ideas: desacralization of sex and considering sex as a socially constructed activity, the use of hormonal contraception, which allowed the efficient dissociation of sex and reproduction, and in the countries that could afford this kind of contraceptive, but now hormonal contraceptive are criticized as a kind of medicalization. We had also considering orgasm as a biological function of sexuality and more important than reproduction itself. We had something which is also criticized, which was the development of pharmacological help for the development of sexual erotic male function. But mostly we can consider that the onset of Viagra and its colleague were helped the recognition of the sexual life of old people, of senior citizens, And it was also concomitant with an increase in the sexual life expectancy, because one of the major obstacles to the development of a sexual life of old people is prejudice. Prejudice, which means that old people were not considered as a sexual being at some point. And now they are considered, and they have the possibility, if they wish, to develop some kind of sexual activity. Last but not least, we have also the possibility of sex and gender change, including legal change, hormonal treatment, and surgery for those who want to carry this kind of operation. And finally, we had in 73 the depsychiatrization, depathologization of homosexuality and trans situation. So it is important to remind whether or not these medical and scientific innovation are still important today, that the sexual revolution was greatly based on some medical and scientific discovery. But then we have, on the side of the sexual revolution, we have also the development of the notion of social justice, which started in the political philosophy of Western Europe in the 19th and 18th century. But we have some important concepts that can be used. We have freedom of thought, liberty of conscience, and in social relationship, political liberties, which means the possibility of association, of democratic institution, freedom of speech and the press, and freedom of assembly. We have the freedom necessary to the liberty and integrity of the person, namely freedom from slavery, freedom of movement, and a reasonable degree of freedom to choose one's occupation. And last but not least, we need to say we have the physical integrity, the right of not being mutilated, either in a culture or for other reason. And then we have the idea that those rights and liberties are covered by the rule of law. So we have on one side, we had the sexual revolution. On the other side, you had the development of social justice. And then we had sexual rights developed in the context of the 90s by organizations such WAS and IPPF, International Parenthood Federation. And then this concept is currently still under work, under modification, under transformation. And what we are trying to do now is mostly to enter the notion of sexual rights in important local, regional, and international treaties to become legally binding through ratification and incorporation in national constitution and laws. This is an important step to reach, and WAS is on the front of this kind of struggle. We had also, and let's not forget, if as chair of the scientific committee, I focus a lot on science and medical discovery and social science also development, we have to remember that freedom, sexual liberties, sexual rights are the product of activism. And since the 60s, we have a lot of different multifaceted activism between women, gay and HIV, reproductive, trans and non-conforming gender identities, and last but not least, all the Me Too movement against sexual violence and consent, and which is very important because it is the right of being the owners of one's body, to decide what we want to do with our body without any imposition of someone else. So we have now the development of sexual justice, and the question is, do we need to include the sexual justice beside social justice, the same way we developed the sexual rights besides the human rights, which is an important body of knowledge. But we need to remind, and there are already some important work done in the field of sexual justice, that this needs to bring human dignity, which is an important concept in the traditional Latin European tradition of ethics and political science, which need to be completed with personal autonomy, and they are sometimes contradictory between human dignity and personal autonomy, because on one side, with human dignity, you are not the owner of your body. I mean, in some countries, you cannot sell your tissues and organs, and because it's an offense to human dignity. But then personal autonomy would be a little contradictory. We need to have full citizenship and community participation and solidarity, rights and responsibilities, and priority for the poor and vulnerable. And last but not least, to include the idea of peace, because war is one of the most important obstacles to the development of sexual rights and sexual justice, besides social justice and human rights. So the development of sexual justice is really part of social justice and human rights in general. And it is important to have in mind that we consider sexual rights as a basic form of human rights. We don't need also to forget another aspect, which is the intersectional approach in sexual justice, which means that we need to use that term subaltern, because the idea, of basic idea of intersectionality is that subaltern categories reinforce each other for the bad and for the worse. And if we need to promote justice, equality, and equity, we need to take into account social class, race, ethnicity, gender, and age, because the more you are included in one of those categories, the more you are going to be dominated and violented. Justice, which is the justice, and we have some difficulties. Sexual justice and social justice is mostly, in our view, and at the moment of history in which we are, it's a kind of ideal for which we need to struggle. And we know a lot of examples of violation and denials of sexual and social justice, which is a discrimination against pregnant adolescents and the expelling of them from school, the denying of single mother to social benefits, the denying of widow and divorced women to have a social life and a sexual life. And it is important to remember that social justice in the community would take action against such discrimination. We need to have also the importance of gender justice, and I was tempted to include sexual and gender justice, but it seems to me that as a slogan, it's better to keep to sexual justice, but this will be something we shall discuss. It is not the end of the discussion, it's the opening of a discussion, and we need to take into account gender equality and equity between women and men, and also taking into account gender identities and sexual orientation, diversities, in order to take into account the systemic, which is important, redistribution of power, opportunities and access for people. It is important to remind that this justice is not only a matter of interpersonal relation, it's a matter of the system who produce and reinforce this kind of equality. Last but not least, we need to say one word, as Anthony said at the beginning of the session, about COVID-19, and which means that we need absolutely, besides the medical, the pharmacological, the vaccination, we need to have a human rights approach to pandemic response and to include equality and non-discrimination, participation, empowerment and accountability. And let's not forget that one of the major negative impact of the COVID is not the COVID impact itself. It is the measures that are put to fight against COVID, and in particular, lockdown and confinement, which are sometimes necessary, but sometimes create more difficulties than good than they happen. So those interested can have some reading material, and I can please invite all those interested to work with us on this topic for the next Congress. Please contact me, and we shall arrange meetings, seminars, round tables, and in personal presentation. It is important that we draw on every situation to develop the complexity and the specificity of the question of sexual justice. Thank you for your attention.
Thank you very much, Alain, for this very thoughtful presentation and the way you gave a historical perspective since the beginning, let's say, of sexology until today. We will have time at the end for questions. I've seen that there's already some very, very good questions, but in order to save time, we will proceed now and we will take the questions at the end. I was just wondering, just a comment, not a question for now, but it's interesting, Alain, and we can also discuss this later, that actually sexual science and sexology started with a very strong connection between science and activism. So it's interesting that the history of sexology is made of that connection. And so I think sexual justice, it's actually the something that is in the middle of that relationship between, sexual rights advocacy and at the same time evidence-based knowledge and science. So thank you very much for your presentation. We will again at the end have time for questions.
Okay, thank you, Pedro.
Thank you, Alain. So it is my great pleasure now to introduce you to the next speaker, who's Marlene Wasserman. Everyone, I guess, in South Africa, and maybe many of you all over the world knows Marlene. Marlene is a certified ASEC couple and sex therapist, doctorate in human sexuality, sexual health medical legal expert, and medical legal mediator. She is also a WHO temporary advisory, sexuality educator, author, and part-time lecturer in sexual medicine at the University of Cape Town Medical School. And most recently, she earned a postgraduate certificate in trauma stress studies from Bessel van der Kolk's Trauma Research Foundation at Boston, USA. And as the founder of Dr. Eve Brand, that many of you know for sure, Marlene pioneered sexual health and rights in South Africa, utilizing radio, television, print, and social media. Currently, Marlene has her own bi-monthly radio show on Radio's 702 Cape Talk titled In Conversations with Dr. Eve, and the theme is Trauma in Intimacy, Injustice and Sexual Pleasure. Above all, she's most passionate about her role as clinician in her private practice, which is now a trauma-informed practice, and she's currently certifying as a sensorimotor psychotherapist through Pat Hodgins Institute Sensorimotor Psychotherapy USA. But let me just say that I've know Marlene for a few years. She was actually a member, a very active member of the advisory board at WAS, where we met first. Yeah. And she was actually the first, even before Elna joining WAS, the first trying to get this Congress, finally, the World Congress to Africa. So thank you also for that, Marlene, and I think you also deserve that, unfortunately, not a in-person Congress, but at least a virtual Congress, and who knows, in the future, an in-person Congress in South Africa, in your hometown, Cape Town. So Marlene will, as you all already know, she's also the chair of the local scientific committee for the Congress, and she will continue the second part of the concept of sexual justice. So Marlene, over to you, and thank you very much again.
Thanks, Pedro. Hello to everybody. Michelle, thanks. You can just begin the presentation. I do want to start out by thanking Elna so much for recognizing my contribution and inviting me to be the local scientific chair. It's really a huge privilege and honor for me. I'm very moved all the time, and remember how old I am, Elna, as I watch your energy and enthusiasm and your passion for this work. You are so deserving of this, and we are so privileged to have you leading us. So Alain started out with a really magnificent philosophical perspective on sexual justice, and I'm going to try and make it a little more practical and a little more emotive, because I'm here as a clinician. And I think that many of us who are here tonight are clinicians. So we kind of struggled when we got together as a scientific committee, Alain, Eric Janssen, Esther Corona, and myself. We struggled with, what are we going to do? What are we going to have as our theme? And we came up with some words in our brainstorming session. We wanted something that would be hot, that would be sexy, that would be relevant, and would be really critical for us to be talking about representing South Africa and the globe. And we then started talking about the world, and we looked outside of ourselves, and we looked at what the world was. And there was a strong sense of being swept away, thanks, Michelle, the next slide, in what was going on in the world right now in this time of COVID, because we started this beginning of last year when COVID started. And we came up with the idea that what sexual justice is a combination of sexuality and social injustice. We were very moved by the social injustice that was happening in the world and is happening in the world right now. And we wanted to begin to play around with the idea of, how does this impact on people's intimate lives? How does it impact on institutions, on laws, the bigger macro world as well? And so we're inviting you, as Alain has said, to play with us in bringing this concept of sexual justice into life. So this is what we've come up with, the idea of sexual justice being the combination of sexuality and social injustice. And let's move through some imagery of what social injustices have been happening in the world. And I invite you to be present with yourself and with your experience as you recall and as you're present still today with the social injustices that are happening on a macro level in the globe, as well as in your own intimate world. Black Lives Matter, gender-based violence, which we know during the time of COVID has become a massive second epidemic. More recently, the insurrection at Capitol Hill, which showed us a whole shift into a different kind of injustice of people. We also know that the continuation of social injustice around people who are less abled, who are LGBTIQAI, people who are migrants, who are refugees, who continue, especially in this time of COVID, to struggle so much to find justice in their lives, to be able to find a place of belonging, which we all long for. And the movement, which really brought about an awareness in a big way, a Me Too movement, which continues in women's lives every single day, is part of the social injustices and the intimacy injustices that we face on a daily basis. Thanks, Michelle. I invite you just to have a moment of reflection. Just take a moment for yourself to reflect on how these pictures make you feel, because we really want this topic of sexual justice to be personal for you, whether you're an academic, a researcher, in an institution, or a clinician. How does this impact on you? The biggest social epidemic of injustice, how does it impact on you? How does it make you feel, and why? And please talk about it in the chats or ask a question. We'll get back to that. Okay, so let's look at this a little more deeply. Thanks, Michelle. I'm going to move you into my country, into our country, where WAS is going to be in September. And let's have a look at sexual justice in South Africa. We want to understand sexual justice, which includes sexual rights, as well as sexual pleasure. We cannot take away people's right to pleasure and rights, as you heard Alain talking about, which fall under human rights as well. Not only does it include sexual rights and sexual pleasure, but it also includes, thanks, Michelle, a number of different principles which Alain went through with you. And I'm going to try and personalize these a little so that we get a better understanding about them. Before we do that, I'm going to ask Michelle to put up the first poll that I have sent in. Michelle, if you would do that, and get you to have your own personal experience. Have you personally experienced any of these sexual injustices through some social injustice in your own institution, place of work, harassment, or your own personal bedroom? And let's see what the outcome of that is. Okay, thank you. So we've got the results already. 64% of you are saying you have experienced sexual injustice, 25% no, and some of you are still unsure what that really means. So we can see that this is something that no one is left behind. Let's look through them a little. Some of the principles, some of the pillars, as Alain called them, of human dignity. Whoa, Michelle, can you take me back a bit? Thank you. Human dignity. Colonialism, Black Lives Matter, what I call sexual citizenship, the rights and responsibilities that always come with rights for all of us in our sexual and intimate lives, how we need to be prioritizing marginalized, vulnerable people, and then something which is called the politics of love, the inequities that happen in love in your own bedroom, and the politics of consent, which is so essential to justice. And we are going to look very briefly at how sexuality is regulated by the law and whether there's justice in that or not. Okay, let's move into South Africa. This is a country I was born in. I am a child of apartheid, and I remember very clearly being part of this and learning about these laws that governed our sexuality. I really do believe that part of the intention of apartheid was to manage and control people's sexuality, because they brought in these two laws, the Prohibition of Mixed Marriages Act and the Immorality Act, that we were not allowed to be present together. We weren't allowed to be present with people who were different to us, people who were called Black, who are Black. There was forbiddenness around it. It was illegal for Black and white people to be sexual with each other. And that created a sense of enormous, enormous pain and terror and injustice in our lives. This is what was happening with justice and the lack of justice in our sexuality and our ability to express any of those pillars in our country. Thank you, Michelle. Let's try and look at some of the cohorts, some of the people who are really affected. And I've just given some who I'm familiar with, and I'm sure you can add on. Sex workers, where is their human dignity? Where is there any justice in human dignity, or is there just criminalization for sex workers? Community solidarity, I don't really think so. We have such an epidemic of racism, not only in South Africa, but throughout the world. Sexual citizenship, really? Is there justice if you are a trans person or non-binary person, or even today, even though legally you're allowed to not be discriminated against if you have a different kind of sexual orientation, but really, do you feel like you have sexual citizenship? And if you are a woman or LGBTIQA, a migrant, a refugee, or a disabled person, Do you really feel that you're prioritized? Do you really feel that there's justice, education, information, and support and access to information to you if you fall into one of those groups? And then when you're in your own bedroom, do you feel there's equity for you? Or is patriarchy, masculinity, the toxic masculinity still part of your life where there is a power disequity? Do you have democratization in your relationship? Do you have that? Think about these things. Do you have justice in your own bedroom as well as in the institutions in which you work? Let's look further at some of the sexual justice around consent. Gender-based violence, domestic terrorism, as I like to call it. We in South Africa hold the flag for the highest incidence of intimate partner violence. We do not have any kind of real consent that happens. Let's linger at how sexuality is regulated by the law. And I've just given you some ideas to think about. Who is permitted to be sexual? People who are married. Who is sexual? People who are not married. Who are you permitted to be sexual with? Well, the law says that, you're only permitted to be sexual with people of your age. What happens to MAPs, minority attracted people? Where is there justice for them? What happens to young people and adolescents who we work with all the time? Is there any sexual justice for them? Are they given access to information, education, and supported in the exploration of sexual pleasure? And the justice gap. We know that there is no justice when it comes to sexual assault cases, that colonialism and racism, disequity comes into that, and reproductive health, which Lebo is going to talk about. Is there any justice in that in the world and in our country? Let's move on. This is my final slide, which represents the world that we live in, the very real world that we live in COVID, and the opportunity I feel that we do have for sexual justice. And I'm going to just use my last minutes, I think I still have, to be able to make it in very clinical perspective for us, to bring in an idea of a case and what our roles as clinicians, and I appeal to the clinicians to think about how to use sexual justice in your own therapy room on a daily basis. The example that I'm thinking of is somebody who recently came into my practice. She lives in a different country, and she has had a sexless marriage for 20 out of the 25 years, and has felt very vulnerable, very lonely, and very depressed in her marriage, and for financial reasons and many other reasons, like many women, has stayed. And during the time of COVID, as has happened to many, many people, she reached out to connect, to touch, to be present with somebody else, and her ex came back into her life. And she's come into therapy with me because she's really confused and agitated and very anxious because this new man, this man who's an ex of hers, is giving her all the support, all the care, all the love, all the feeling of connection that she needs right now. And the reason she's coming to therapy is because she feels that something isn't right. She feels it in her body, and she senses that there is an injustice happening, but she can't quite put her finger on it. And the injustice that she's feeling, without naming it, is that he interrogates me. She says he interrogates me all the time around my past sexual behavior. He wants to know every single detail of every single sexual activity that I did with this person. And she feels the discomfort and the dis-ease, which got her to make an appointment. Now, what do we as clinicians do when we feel that there is an injustice that has happened over here? Do we talk to it, or do we stay neutral? Do we recognize that it is our role to be advocates of sexual justice in our therapy room? I leave it with you. Thank you for your attention.
Wonderful. Thank you so much, Marlene, and thank you for making it so very, very practical. Unfortunately, we don't have time for questions right now. We will certainly take your questions to the end. Thank you to everybody that's putting questions in the Q&A section. And we are now going to take a 3-minute break, only 3 minutes, just a quick comfort break. But Michelle, I would like to ask you, as we go into that, will you just put up the results of the poll where we ask if people are familiar with the concept of sexual justice? Can you just quickly put up that poll for me, please? In the meantime, if you want to quickly run for your break, we'll be back in 3 minutes. Fantastic. So what I can also see from the questions we're getting in the audience is we have an audience that has been passionate about this for many years, and you're certainly taking the lead. And we are inviting you to please take part in this conversation actively. We're taking note of every one of you that has been commenting, and we will certainly be taking your contributions into consideration as we move towards this conference. Thank you very much. We will see you in 2 minutes from now. Thank you. Welcome back. I know that was very short. So, Uwemedimu Esiet asked me to introduce him just like this. Convener of the African Conference on Sexual Health and Rights and honorary president of the Cape Town Conference. And he doesn't want me to waste any time, and straight over to him to tell you about the strategies employed to bring about sexual justice in Africa. Thank you, Uwem. Over to you.
Thank you very much, Elna, and it's my honor and privilege to be speaking tonight to all of us. It's meant to be a conversation. I know you can all see me, or at least you can all hear me, but I can't see you, but I can feel each and every one of you. So I want to also thank you for being here. I'm meant to be looking at Africa as a continent and to be looking at strategies. But I started by interrogating what is the assumption. The assumption is that sexual is in the reproductive health framework in Africa. And I needed to validate that assumption. So how do we go about validating this assumption? I decided to take a look at the continental policy and framework on sexual and reproductive health in Africa. I hope most of us know that there is a policy framework designed or midwifed by the African Union. And this whole effort came to be in 2005, quite a long time you may think, when the health ministers of Africa met in Botswana and approved a continental framework. And this was presented to the African heads of state in 2006 January, and at Khartoum in Sudan, they adopted the policy. And the world clapped for Africa that, wow, Africa has a great continental policy and framework. And it is stated that this continental policy and framework is for sexual and reproductive health. And this is supposed to deliver universal access to sexual and reproductive health in Africa. But can we take a step back and interrogate that policy? Sexual is largely missing in the policy. And the reason is that fundamentally the policy was enacted to respond to maternal morbidity and mortality, which means addressing women dying from preventable causes in bringing back life, which means giving birth. And then to prevent or minimize child morbidity and mortality, to ensure that babies are born alive. And then about that time, the HIV/AIDS was the major issue in Africa. So that was also added as one of the reasons for the policy. So largely, the policy was meant to address those three things. And this was in the era of the Millennium Development Goals. And therefore, that policy was teased out and it addressed issues like financing and then looked at how these other issues could be addressed. But interestingly, it looked also at abortions, unsafe abortion. But then there was the challenge of how do we bring all of this about? And the policy, in part of its justification, said they were trying to help us to respond to our commitments as a continent or countries from the continent to the ICPD program of action. And therefore, the policy took the reproductive health component of the ICPD, embraced the definition 100%, but was silent on the satisfying sexual life component of the definition of reproductive health. Because if most of us or all of us will recollect, the definition of reproductive health in the ICPD document embedded sexual health. Now, is that the first time the world is talking about sexual health? No. In 1975, the World Health Organization came up with the first concise technical working definition of sexual health. And the definition looked at the somatic, looked at the emotional, intellectual, and the social components of sexual health. Interesting. And it did not stop at that. It went ahead to relate it to clear outcomes. And it talked about personality, communication, and love. And embedded in this definition is the right to sexual information and sexual pleasure, which meant that as far back as 1975, the World Health Organization has helped us, taking forward all the earlier findings or research findings around sexual health, especially the Masters and Johnson's groundbreaking work that helped us to look at the human sexual response cycle. But lo and behold, the African policy framework that was to drive sexual and reproductive health did not bring all of this to play. Let us also remind ourselves that in the year 2000, the World Health Organization again convened that technical consultation, the landmark one, and this was 25 years after the first. And I want to say that there were I think there were 7 Africans in Geneva at that meeting, and I happen to have been one of them. I was not at the 1975 consultation, obviously. I think I was still in high school then. I was just finishing or about finishing high school. So I couldn't have been at that consultation. And there was a similarity of thought between the 75 and the 2000 conversation. And there was also a better elaboration. And I want to bring that to the fore before I take us to the next stage of looking at what we have lost in Africa and why we cannot even be looking at strategies for bringing about sexual justice without looking at the inherent injustice that we have had fundamentally in the policy framework. And that policy framework is still the guiding framework for our continent today. So in the year 2000, the key aspects that stand out, even from the definition, includes issues around capacity, dignity, and the fact that you cannot achieve sexual health without sexual rights. Now, this is the problem. Human rights framework has been on with the Universal Declaration of Human Rights. But now to bring human rights framework into the sexual health conversation, to have sexual rights, is an advancement of human rights. In fact, the right to life and well-being, and the right to association, and the right to aspirations. Because these are the inherent issues, core issues that sexual rights hinges on. And then if you look at the way the sexual rights was elaborated in 2000, coming out of that technical consultation, I think there are about 10 core issues, but I will speak to a few of them. It talked about a global standard, which meant there is supposed to be a minimum standard that will guarantee sexual health. It talked also about the right to information. It talked also about sexuality education, not necessarily comprehensive sexuality education. It talks also about bodily integrity, and it goes ahead and talks about shared intimacy and all the other great things. But importantly, it recognizes that the right to want to reproduce with who, when, and how is inherent in the sexual right of each and every individual. And then the right to sexual pleasure, which means that we cannot therefore be looking at the outcome of our sexual health as if that is the primary basis for having sexual health. And I may take this a little further. What we have done in Africa, or we are doing, is that we have problematized sexual health and not see sexual health as an inherent component of the human existence. And we have therefore not followed science or taken science into policy and taking science into our lives and living. And therefore, what do we have in Africa? We talk about gender-based violence. Gender-based violence is as if Africa is the global headquarters of gender-based violence, because the world's 4 worst countries of cases of gender-based violence are here in Africa. And I mean sexual and gender-based violence. Early and forced marriage, which is one of the issues that the continental policy has attempted to address. I can tell you that the top 7 countries in the world on early forced marriages are African countries, from Niger through Central African Republic, Chad, Mali, South Sudan, Burkina Faso, and Guinea. And then female genital mutilation. The top 5 or 6 countries globally with the highest rates are in Africa. Then let us look at homophobia. The whole continent of Africa, except for 2 countries, South Africa and Cape Verde. In fact, I can just say we are homophobic. Science has moved beyond the binary to recognizing that normality is beyond binary, and that the spectrum of humanity is not male or female only. In between, there is a lot that we are finding out and discovering about people. What does this mean for the concept of justice on the continent? Groups have been labeled, and such groups have resorted to self-help to look for justice. So you have, for instance, declarations coming from the LGBTQI community, or what I would call the non-binary communities. Even within the heterosexual community, we are cherry picking amongst ourselves. Sex workers stand alone to fight for their rights. Because of the binary nature, we tend to think that sex workers must always be females. So you expect that when sex workers are fighting for their rights, they are largely females. But that is not so. Sex workers can also be males, they can also be trans, and they can also be non-binary people. People also who suffer from any form of disability are not even seen to be sexual beings. Or if they are seen to be sexual, the expression of their sexuality is portrayed as if it is something that should not be cherished and promoted. That also is a major injustice. And therefore, people with disabilities now tend also to come together as to chart their cause. When we move, and what does this say? we need to recognize the fact that the threat to the sexuality of anyone, irrespective of their color, their ability or disability, their orientation or gender identity, or philosophical or political persuasions, should not be downplayed. We need to embrace the common thread of our humanity. And what that means is that everyone is a sexual being, whether they choose to express their sexuality or not. And that everyone must be given the necessary support and environment to find full expression of their sexuality. To do otherwise is to create or promote sexual injustice. So to date, a few efforts are being made, but they are little and far-fetched. People are interrogating it by groups. They are using the human rights frameworks because many national laws do not recognize sexual health, sexual rights, and do not recognize, therefore, sexual justice. This will continue to be a challenge, but we need to come together. We need, in Africa, a movement that is all-embracing, that cuts across all the barriers, a movement that brings all of us to the table to appreciate our common humanity and to know that we must continue to work together to overcome sexual injustice, to prevent injustice, and to promote justice in the area of sexual health so that we all can enjoy our sexuality. This will bring about peace. This will enable us to embrace our diversity. This will enable us to chart our pathway for development and accelerate our growth and development as a continent. I will wait for your thoughts. I shared a big question that for our consideration. And the question is this: what does sexual justice mean, either as a concept or as a definition in your indigenous language? Because in Africa, we have well over 2,000 languages. Thank you for listening. I look forward to engaging with you during the question and answer sessions. Thank you.
Thank you. Thank you very much, Uwem, for this fantastic overview of sexual justice in Africa, around Africa. And actually, let me say this, we will have time for questions afterwards, but let me say that as president of the World Association for Sexual Health, I'm very proud to work together with you, Uwem. We have met for a long time within WAS, and your efforts and your work, lifetime work to promote sexual health and rights in Africa and all over the world are impressive. So thank you very much for that. So it is actually my great pleasure now to introduce Lebogang Ramafoko from South Africa. Lebogang is an experienced sexual and reproductive health and gender expert with over 25 years in the field. She's also an internationally recognized social and behavior change communication expert, having led the development of the Soul City Award-winning entertainment materials for over 15 years. Lebogang is an outspoken feminist, a sought-after speaker, facilitator, and trainer who's passionate about social justice for young women and girls. Lebogang combines her own life experience as a Black woman who grew up in apartheid South Africa, thrust into activism at an early age, and the skills she acquired through her training to speak out against injustice wherever she goes. She's one of the prominent media commentators and advocates on various social issues facing women in South Africa. It's a great pleasure to have you here, Lebo, sharing your experience, knowledge, and advocacy work with all of us. Thank you. The floor is yours.
Thank you very much for having me. And it's such a great pleasure to speak after such esteemed scholars who have given thought to the whole issue of sexual and reproductive justice. My name is Lebogang Ramafoko. I am the chairperson of the board at the Sexual and Reproductive Justice Coalition based in South Africa. And before I share some of my thoughts, I come to this forum as a Black, middle-class, heterosexual woman. It is very evident from the talk that we have heard that the science is there, that everybody has a right to enjoy and have access to sexual health. So the question we can ask ourselves is, why is that not happening? And I think until we recognize that ultimately sexuality, sex, reproduction is clouded in the power differentials that we experience in the world, until we recognize that unless we address all of those power dynamics, we will not be able to achieve sexual justice for everyone. Let me just introduce the SRJC to you, which is an organization based in South Africa. Next slide. We have a vision at the Sexual and Reproductive Justice Coalition of a future of sexual and reproductive justice informed by an intersectional perspective in which all people, irrespective of class, race, gender, sexual orientation, gender expression, disability, age, religion, or any other factor, can enjoy their sexuality, make reproductive decisions, and access high-quality services in ways that enhance their dignity, bodily integrity, and well-being. Next slide. Our mission is to provide a platform through which individuals and organizations produce and use evidence to foster informed public debate and consensus building, to working towards holding policymakers and implementers accountable for progress towards realizing sexual and reproductive justice for all. Next slide. I think for me, what is very important is to understand why reproductive and sexual justice is important. Firstly, what sexual justice means or does is that it amplifies the condition under which people can exercise their reproductive health. It also secures everyone's right to bodily autonomy. It gives everyone the right to decide on what to do with their body and how to express themselves. But also, it positions reproductive and sexual health within a broader framework of health beyond the absence of illness or providing health commodities. And it recognizes that where you live, access to information, your ability to speak, your right to question, your right to expression, whether or not you are subject to violence in your life, all affect your reproductive health. And therefore, equity becomes very important, that we think about those that are marginalized, we think about those that do not have a voice, and we work together for a more equitable and inclusive framework in everything that we do. We recognize, and it recognizes that while we may speak and have policies around sexual health and reproductive health, not everybody has equal access. And I think it's very important that we basically speak about the work that we do, even as scientists, even as healthcare providers within a justice framework. Because when we speak about justice, we go beyond what we provide, but we also focus on who has access and what are the factors that either enable or disable everybody to have access to even some of the health commodities that we provide. Next slide. So the Sexual Reproductive Justice Coalition was founded at the end of 2015, and everyone who joins, whether as an organization or an individual, has to sign on the statement of intent, where everybody agrees that we are working from an ethics of justice and an ethics of care, and that we engage different stakeholders, those working in advocacy, in research, in service delivery, in education, in policy analysis and activism in the fields of gender, sexual and reproductive justice, health, rights, and care. And this is very important. And the importance is that one other issue that disables us from achieving sexual and reproductive justice is the way in which we work in silos. It's also the way in which some of the provision of health, some of the policies that are implemented from a top-down approach. There is hardly many platforms where activists can basically work with researchers, where researchers can be part of an advocacy agenda, where activists who are working on the ground can be part of policy analysis, and where all of these actors can come together and work together and basically advance the same cause of sexual and reproductive justice. Next slide. We focus on the following 5 areas, and we work in partnership with other organizations. The first one being comprehensive sexual education. I think we all recognize that comprehensive sexuality education is very important, but we also know how sometimes in various education settings, there is a pushback to comprehensive sexuality education. We've experienced even in South Africa when it was introduced, how much there has been a lot of pushback, around comprehensive sexuality education. Contraception is also a factor around women having all the commodities that are there, having a right to choose, having a right to ask questions, having a right to say what it is that they want and why they want it without being forced either by a lack of information or a lack of choice. We recognize sex work as work, and we are also working very hard for the decriminalization of sex work. And the other important area that we work in is around queer health and rights. We've got different working groups who are working in areas of health. Others are working in the legal framework, addressing all issues that are legal. There's also a working group on media and communications, and then a working group on research. And all of these comprises of individuals, of activists, of organizations, of scholars, both locally and internationally, who come together and basically share their insights in the different working groups. Next slide. I think for me, what is very important is to understand the context in which we are advocating for reproductive and sexual justice. Firstly, we actually need to speak about various cultures that are used to impede access to sexual justice. We've got cultures that are homophobic, cultures that are caught in their colonial, which bring colonial histories into the fore, and cultures that do not expect that young people, that women, that non-binary persons have a right to even exist, let alone sexual and reproductive justice. Religion is a big factor. And we have seen how, especially groups coming from outside of Africa come into Africa in the guise of religion, particularly Christianity, and come into various African countries, are given a seat at the table with policy makers, with decision makers, and they use the language of religion to deny people their right to justice. We also have laws and policies around population control that are founded in South Africa in particular from a legacy of apartheid that basically was about controlling particularly Black women's sexuality, their fertility, and we have seen them how they have really informed our own outlook towards sexual justice in South Africa. But we are not immune to some of the issues that are happening globally. You look at the gag rule until very recently, when the US changed presidency, the gag rule meant that many others and many organizations and service providers could not speak about abortion if they wanted to take money from the US. We have seen how our own government, including in a country where abortion is legal, because of the geopolitical arrangements and funding that comes from outside, could not even speak back to a country like the US. We have seen how in many instances, when funding comes, it prioritizes biomedical intervention, but does not want to fund or even support any work that is around advocacy and a lot of work that activists on the ground are doing that are basically addressing the social and structural barriers to access to these services. We have seen how we have been, in the name of research and evaluation, we have been forced to adopt what is called evidence-based methodologies that are devoid of the realities of the people on the ground, and how, because the funder comes with money, also dictates and controls who can be at the table and what gets funded. You just look at the flurry of presenters that comes in, the flurry of NGOs that come in, even in the time of HIV. In my other work, you would look at how many organizations who want to access the funding will have to tone down the language of rights, will have to tone down the language of justice. When in fact, for a Black woman who is not even middle class like myself, who cannot be invited to these forums, will not be able to get a seat on the table. And we have seen how in South Africa that although there are laws like the right to get an abortion when you require, the implementation still gives the government and the service providers the right on whether or not you can have access, to a point where less than 30% of facilities that basically offer abortions in South Africa are doing it, because we've also given healthcare workers the right to refuse a woman what is her right. So the issue for me about justice, it is an issue of challenging power relations that exist, the heteronormativity that exists, the power in terms of who has the voice, who has a seat at the table that exists, the geopolitical power that exists, so that by the time we are sitting in Africa, some of these policies that come with funding, some of the conditions that come with funding are dictating around what literally happens to my uterus and my vagina as a woman, or any other person for that matter, that determines whether or not, if I am non-binary, I even have a right to exist. So there is a lot of solidarity and a lot of work that needs to be done to ensure that even as providers, as decision makers, we include the language of reproductive justice, understanding that it is unjust when the people whose lives we are talking about are not at the table when we do laws. And we really need to speak truth to power and question the status quo. Thank you very much.
Thank you very much, Lebo. It was an amazing presentation, full of energy, and I think you gave a pretty clear picture of sexual justice issues around that are going on in South Africa and all over Africa, actually. So thank you very much for that Thank you for joining us in this contribution. So now we have time, hopefully, finally, for questions and for the debate. And I will ask every panelist to please open your camera so we can start. Actually, before going over to Elna, let me just say that we actually received 24 different questions in the Q&A. So we have a lot of very good, interesting questions. We cannot, of course, discuss all of that, but they're quite interesting. So we can actually, if not here, but afterwards, also reply in writing. So Elna, please, over to you.
Thank you, Pedro. I'll just put there in the chat just a little summary of justice is the morally fair and right state of everything. To have justice as a person's character trait means that they are just over everyone, they treat everyone the same, or how they would like to be treated. And the three key principles of fairness, equality, and access. And it really came out in all of our speakers' presentations, how we are trying to build those three pillars. And I just want to salute you, specifically Lebo and Uwem, being involved in these things on such grassroots levels. And we can see that what you are doing is actually taking its effect. And it's great to present that to the world as well. Thank you very much for that. I would like to start with a question from Pierre Barot as a clinician in South Africa, and it is about adolescents. And what I want to say about fairness and justness is there are so many questions, it's very difficult to be fair to decide whose question we will put out here. So, sorry, let me now just get back to Pierre's question because it was right at the start. And Marlene, I'm going to ask this specifically to you because I know you were very much involved in sexuality education for young people in South Africa. Would the panelists please comment on how a sexual justice agenda might serve the needs of young people who are often prevented from being exposed to comprehensive sexuality education because their parents or guardians believe that such exposure is harmful. Parents have rights, although these may be sometimes limited, to choose what their children are exposed to. How do we win over these parents who mean well? Information, research, and science may not succeed in the face of ideology. Can you comment on that first, please, Marlene?
Yeah, I have, as you say, done so much work to be able to work with this, as Lebo has as well, with her magnificent work with Soul City and the work she continues to do. And I honor you for that, Lebo. I give you an example, just a personal example of the fight for justice for young people. Is that a few years ago, I was invited to be the consultant on the life skills, sexual orientation life skills for the 2020 pupils. And I sat together with a team and we put together curricula for life orientation and sexuality education. And there was a massive kickback when it got leaked somehow to the press that the only thing that they could come up with was that I had promoted masturbation for young people from grade 4, 5 or something like that. And I was annihilated, not only from the religious community, but from many other sectors as well in society. And to this day, I've never actually seen the final outcome of that curriculum. I don't even know what they used and if they used it. They just saw the word masturbation and the press went crazy and parents went crazy. And it was like, well, actually, you don't really have to teach children about masturbation. So why would we put it into curriculum in actual fact? So this is a huge issue. And I really feel that it begins with children, with adolescents, with young people, beginning to get them into sexuality education as part of the curriculum, and comprehensive sexuality education into the curriculum. And what everyone's been talking about intersectionality. I want us to be really aware, and I guess because I am working from a trauma-informed lens right now, what our specific communities of children look like in South Africa, that our children are incredibly traumatized and therefore very vulnerable and at high risk for all kinds of very high risk of sexual abuse and sexual difficulties, high risk sexual behavior. So for me, it's actually an imperative that we need to protect children who come from such traumatized environments across the country, in different communities, to be able to give them this risk prevention, to be able to at least have some kind of access to information, to services, to pleasure in a really informed way, in a comprehensive way within our school system. And that's where we also have to recognize, the cultural and respect the cultural fears that do exist in this country and in Africa around teaching children about sexuality. So, I feel like, I've spent a lot of my time doing that. And Elna, it's kind of handing over to you and young people to pick it up, and good luck to you, because I really don't know if we're going to make any difference in this country to protect our children.
Thank you, Marlene. And like one of the, yes, Lebo, I just want to say that Jessica Santos commented in the Q&A that she believes that comprehensive sexuality education is where the groundworks lie for sexual justice. What we teach our children that is where it will start. So maybe not in our lifetime, but we can make an effort of focusing on comprehensive sexuality education. Yes, Lebo.
So when I was at Soul City, we ran a program at primary school for 8 to 13-year-olds called the Soul Buddies Clubs, that at some point had 155,000 clubs across the country. And what became very important is that you start with the teachers themselves on value clarification. And it is amazing just what the history of sexual abuse has been in the country, but also sexual inhibition, because in a lot of ways, the training that you do with the teachers reveals their own traumas around sex, mainly caused by a lot of the myths that have happened before. And it is also very important that you also bring parents into the program. Fortunately, we had built as Soul City a credible brand. And what it meant is that they trusted the information that came from the program. And therefore, our program in schools was then seen as credible. But it's very important that we work with parents. Let us all understand that we have come into where we are right now through not a process of learning, but a process of unlearning. So there is a lot that needs to be unlearned just to expect as a parent that your own children are sexual beings, and the fact that they also have a right to sexual pleasure. So a lot of the programs that we do around comprehensive sexuality education should also be comprehensive sexuality education for caregivers, because some of the children are not staying with their parents, but all the caregivers in the equation.
I want to just add in, Lebo, that what I found the most effective input or interventions or impact that I had was going online and having access, young people having access to an expert. I would go online every Sunday night on YAL through Africa, and young people could come in and anonymously be able to get at least a modicum of information and education. And I think, we really have to capitalize on social media, because that's where they are. And at least, even if we're not able to change the system, we're able to one-on-one make a huge difference, knowing that and I know there are lots of online platforms, but I really do think that that's where the change has to come.
Thank you. Well, let me say that there's a lot of very good and interesting questions. And I want to add one, which actually is related to pleasure. One of the first questions from Jess McCrone is representing the pleasure project related to the WAS work. So he says that he's curious if you think pleasure holds significance in the concept and pursuit of sexual justice as it developed in the process of the next WAS Congress in 2021. So just to remember that the WAS Declaration on Sexual Pleasure was actually released in the last World Congress in Mexico City. So I would leave the question for all of you, and especially for the ones who are strongly involved in the scientific organization of Cape Town of the next WAS Congress. So pleasure in sexual justice.
Alain, you want to go first?
No, not immediately. I think people.
Well, we certainly are going to factor in pleasure because, as you saw in my presentation, sexual rights and sexual pleasure are an absolute integral part of sexual justice. We've just added in the different pillars as well. That sexual pleasure is something that we're tagging onto everything that we say, and it will certainly be part of any kind of declaration that we make around sexual justice. So yeah, do not be afraid that we will leave that out. It's absolutely an essential part of WAS.
Thank you, Marlene. Any other comments, Uwem?
Yes, my idea is because we are having this in Africa, we should also explore the narrative on aphrodisiacs in Africa. Because Africans are sexual, very sexual, but somehow they don't talk about it as people in the West do. But they have things that they use to promote sexual pleasure, and they are very natural. I'm sure Lebo, you guys can speak to what you have in South Africa as well, you know, and therefore it can become a good conversational point for us to be able to talk around sexual pleasure. Because see, when we are looking at some of these concepts, the way we throw them down, we don't bring them into the lives of people. You know, people want to please their partners and they are, you know, so there is mutual desire for pleasure, but they don't come out openly to say, I'm seeking pleasure. I want pleasure. I'm giving pleasure. I'm receiving pleasure. So I just think we need to figure out how to have what I may call a moonlight conversation, you know, around pleasure using various strategies. Thank you.
Thank you, Uwem. You know, what we found very interesting as the WAS advisory when we came to your conference in Kenya last year is we were talking a lot about pleasure in WAS, and we thought that, you know, bringing pleasure to Africa is it maybe going to be wrong because you've got female genital mutilation and, you know, there are such serious things going on in Africa. People won't like it if we raise the topic of pleasure, and we were completely wrong. People love the topic of pleasure. That is what all of the questions were about. That's what they want to hear about. So we are very happy to hear that we're also on the right track there, and that we will keep on incorporating the concept of pleasure in what we do at WAS. I want to bring up the concept of gender. We've been having a conversation with Deborah Tolman here in the background on this, and I know, Alain, that you completely support the notion that when it comes to fairness, equality, and access, women lag behind. But I want to ask you, Uwem, how do you see this concept of sexual justice, and how will we be able to compensate for the fact that women lag more behind in most societies than, you know, than men in general, particularly in Africa?
Right, and I'm not saying that this is a one cap fits all, but what we need to recognize, or what we need to do, is to encourage safe spaces for women to have conversations. Women want to talk, and women must be encouraged to talk. And therefore, the more women come out to express how they feel and what they want, we encourage the men to be listeners. And for the first time, not to be the initiators. Because you see, the patriarchal paradigm presupposes that man must want and a woman should be docile. And that is not a natural way. Women want, and women have the right to want. And women have the right to pleasure and the right to leadership in sexual intimacy. So this is the kind of thing we need to think about, and we need to listen to women more. So I will throw it back to the African women, and I will say to Elna, Lebo, Marlene, and all the women from Africa who are part of this process, please advise us. as to how to release, to ensure that you enjoy your bodily integrity, autonomy, agency, liberty, and indeed find your pleasure. Thank you.
Thank you, Uwem. That was excellent. Alain, I wanted to pass it to you for a final comment and then back to Pedro to end the panel discussion, please. Thank you, Alain.
No, it was just to draw on what Uwem just said about gender. I think, men also deserve some attention, because I use a lot the concept of masculine hegemony, which means that the male dominant model, which is a problem for women, is also a problem for men, because men have to conform to a dominant idea of what is to be a man. And if they don't comply with this model, they are treated very badly, So what I like in the notion of gender is that it should not be reduced to women, because if we cannot work only, since if we deal with heterosexual people who have different gender, sexual relation, we need to include both in a systemic approach in which women deserve attention, but men also deserve attention. And also, I don't know exactly in Africa what is it about, but we don't speak a lot of the reproductive rights of men. Of course, patriarchy is considered as something to be contested, to be attacked, and etc. But beyond the systemic dimension of patriarchy, what are the rights? What are the possibilities for men to access to small children, to educate, to access to education of small children? And at least in the Western world, in France, in Europe, this is a big problem, because when a man in a family starts to be interested in educating small children, they are very often accused of pedophilia. And this creates a big resistance, since at the moment, historical moment, where men start to be interested in the education, to get involved in the education of small children, they may be accused of pedophilia. So this is something I would like to see how it develops in different culture, the role of men in the reproductive and education.
Thank you, Alain. Let me, I think we still have around 2 minutes, because there's a very interesting question, which is actually, I would say, provocative question, but I will still give it 2 or 3 minutes for that. I know that we are almost ending, but Simon Rossi says that he worries about adding sexual justice for three possible reasons. In the West, the public may equate it to rape or harassment issues. And in Africa, the term can too easily be misused by politicians to legitimize criminalization and oppression of key populations. So for me, it will be interesting to hear what your thoughts on this, particularly from the perspective of Africa.
Uwem, are you?
No, Lebo, I want Lebo to, let the women take the lead now.
It's an interesting take. I'm not too sure how it can be used, because by definition, it would mean that if you persecute those who are non-binary, it means that you are acting in an unjust manner. And I think for me, it's not only in what you call it, but it's also in the approach that you use to make it a lived reality. So first and foremost, it would be making sure that everyone, regardless of their sexual expression, sexual orientation, have a right to be, and their rights are recognized and protected. And then you make sure that everybody has a right to access to justice, and you create the instruments that make it possible that if any person's rights are violated, they can seek a just cause. Just going about and speaking about sexual justice without saying how does it find expression, what are the legal instruments that are there, what are the policies that are there, and how are these rights going to be protected so that everybody can get justice is also going to be important.
Thank you very much, Lebo. I think that's a very good final way of finalizing our webinar. Thank you very much, all of you. I will actually pass the word to Anthony to close, but let me just say before passing the word to Anthony that it is a great pleasure again as president of the World Association for Sexual Health to be here and to be present in the moment where we will actually do this first World Congress in Africa. And let me say that Alain at the beginning also said that he was born in Africa. I was also born in Africa, in Mozambique, actually close to South Africa. So for me, it's also a very special moment. So thank you very much, everyone. I see that we have hundreds of people, colleagues from not only South Africa, I think many of you from South Africa, and many others from around Africa, but also around the world. So this was really a world event with an African flavor. Thank you very much. Over to you, Anthony.
Pedro, thank you so very much. That was really a remarkable conversation. Thank you to the grace of the moderators, and thank you to the expertise and the deep engagement of the panelists. And thank you to all of you for your very thoughtful questions and for your engagement on the chats and in the questions and answers. Lots of questions which haven't been answered, and this really is an invitation to an ongoing conversation. These questions can continue and they can blend into the next webinars and all the way up into the conference. And it's an opportunity not only to speak in the conversation, but really to form the substance and the shape of the conversation. So we really want you to make contact with us in order to be part of creating this Congress. This I think will make it ever more remarkable. We want you to step into SASHA and WAS as members, please. We want you to register for the next webinar and also to give us some feedback. And please take note that CPD points will be available to all SASHA members. So thank you again to all of you. We wish you all well in safety, and we look forward to seeing you again next month. Goodbye.